Hello, I am Dr. Artis Hoven, an infectious disease specialist with the Kentucky Department for Public Health. For the past several months, we have been engaged in a number of activities to prepare our state for the possibility of a local Zika outbreak. Raising awareness about the Zika virus is very important to us, so we are going to spend quite a bit of time talking about the virus so you know what it is, its impact on public health, and what we can do to prevent the spread of Zika in Kentucky. Whenever an infectious disease is identified as a global health threat, people start to feel a great deal of concern and fear about what could happen. We have put together a series of messages to address what we have been doing at both the state and the local level, as well as what you can do at home to help eliminate these fears and replace them with a sense of preparedness and responsibility to take action. We are calling this campaign Fight the Bite Day and Night because Zika prevention is mosquito prevention. Let me say that again. Zika prevention is mosquito prevention, and we want every Kentuckian to be aware of the risks associated with mosquitoes. Thank you for taking the time to learn a little more about Zika. I hope you will take this information to heart and make Zika prevention a part of your regular routine this summer. Most of the recommendations are simple, everyday things we all can do, and they just might make all the difference in preventing the spread of this dangerous disease.
Hello, I'm Dr. John Poe, State Public Health Veterinarian. As you may be aware, we have medical doctors, nurses, entomologists, agricultural specialists, and health policy leaders focused on the issue because Zika and vector-borne diseases in general are topics that affect our world on many different levels. During times of high vector activity, June, July, and August, people need to be aware of the health risk associated with time spent outside, whether through work or recreational activities. Hikers, campers, and residents of areas with heavy tick and mosquito activity need to be aware of the illnesses associated with tick and mosquito-borne disease transmission. Of course, being a veterinarian, I'd be remiss if I didn't take this opportunity to emphasize the risk of vector-borne diseases for our pets. Many of you probably routinely give your dog medication to prevent heartworm disease. I find many members of the public are surprised to learn that heartworms are spread through the bite of a mosquito. Just a reminder that as we talk about vector-borne diseases and protecting Kentuckians, we need to remember our pets too. This all brings me back to my earlier point regarding Kentucky's Zika response and the broad range of individuals represented in this video today. It is a great example of the One Health concept, which recognizes the health of humans, is connected to the health of animals and the environment. CDC uses the One Health approach by working with physicians, ecologists, and veterinarians to monitor and control public health threats. We do this by learning about how diseases are spread among people, animals, and the environment. Successful public health interventions require the cooperation of human health, veterinary medicine, and environmental health communities. By promoting this collaboration, we hope to achieve optimal health outcomes for both people and animals. Thank you.
Hi, my name is Doug Thurman, and I'm the Deputy State Epidemiologist for Kentucky. What I want to talk to you about today is personal prevention against Zika virus. At the time of this taping, the only way you can get infected with Zika virus in Kentucky is to go to another country that's got Zika virus or have sexual relations with someone who was in one of those countries and got infected and came back. So what I want to talk to you about today is prevention of getting bitten by mosquitoes if you go to one of those countries, or should Zika virus come to Kentucky, how you would prevent getting bit by mosquitoes here so that you aren't at risk for that. And mosquitoes carry a lot of different illnesses like West Nile virus, and so we want to be careful around mosquitoes all the time. So there's two primary ways to keep from being bitten by mosquitoes. One is to keep your environment clear of mosquitoes, and the other is to keep yourself from mosquitoes when they're around you. So let me talk first about how to keep your environment free from mosquitoes. The main thing you want to do is stay in air-conditioned areas. Mosquitoes don't like the air conditioning areas, so they will stay out of that, and if you are in there, you should be fairly safe. However, if mosquitoes can get into your home or hotel room, you want to make sure that there's screens on the windows and doors so they can't get in, and keep those windows and doors closed. On the screens, you want to make sure they don't have any holes in them, big or small. Mosquitoes can get through a hole as small as something that a pencil tip or pen tip can go through, so you need to be looking for those, inspecting them, and repairing those holes or covering them or replacing the screens, and make sure there are screens installed on all the windows and doors. If you are in a house where mosquitoes can get in, or a hotel room, you might want to have bed nets up so the mosquitoes can't bite you at night. Most of the mosquitoes that are carrying Zika virus are day biters, so you need to be aware day and night of how to keep mosquitoes out of your area. You can also use insecticides to keep the mosquitoes down in your area. You can use sprays, which are typically used outdoors, and mosquitoes love to hang out in areas that are dark and cool, so they might be under patio tables or chairs or around plants out in the yard, so you can spray in those areas. Or indoors, you can use foggers that will get rid of all the insects, but you need to make sure all these insecticides you use are applicable for mosquitoes, because some work on different insects, so you need to look at that. You can also use mosquito coils outdoors, say if you're having a barbecue or something, to keep them out of the area where your people are located for the time being. You need to keep standing water out of your immediate area. Most of the mosquitoes that we see around Kentucky are going to be short travelers. They're not going to go hundreds and hundreds of yards or miles. They'll be 25 to 50 to 100 yard radius of where they go. So if you keep the standing water out of your area, they're not going to breed in that area, and that's going to keep them down. If you can't get rid of the water, can you cover it? Or if you can't cover it, can you put a screen over it so that the mosquitoes can't get to it? Finally, there's a thing called larvicide you can put in the water that keeps the mosquitoes from breeding in that water, and you can get that at local hardware stores often. So, how do you keep mosquitoes off of you if they're still around in the environment and you can't get rid of them? Well, the first thing is to cover your exposed skin. You want to wear long sleeve shirts, long pants, closed-toed shoes, tuck your clothes in, and leave as much or as little skin as possible out where mosquitoes can get to it. If you do have exposed skin, or you can treat your clothes with permethrin, I forgot that, you can put permethrin on your clothes, and that will keep them off for a period of time. But if there are still mosquitoes around, you want to use repellents, and you want to put it on your exposed skin areas, and use products that are registered with the EPA, because those products are safe for both the environment and human use. There's the important point here is, what is the active ingredient? DEET is recommended, and you should have at least 20% concentration of DEET. You can also use picaridin, PMD, oil of eucalyptus, IR 3535. All of these are good active ingredients, and you just need to read the instructions on the bottle and make sure you do it properly. The higher the percent of the active ingredient, the more likely it's going to keep mosquitoes away. But if you do see mosquitoes getting back on you, it's time to reapply the repellent. Don't use it in cuts or wounds, anything like that, around your eyes or your mouth, and apply just enough to cover the skin. You don't need to over apply it. That's not going to do you any good. And with children particularly, you need to be careful. Don't give it to them to apply to themselves. You need to put it on your hands and apply it to them. Don't put it on their hands though, because they may rub their eyes or their mouth and get a stinging sensation or something like that. One important point is that pregnant women who are at the most risk for Zika virus can use any repellent to keep mosquitoes away. So there's nothing that's not recommended for them that's on the EPA registered list. If your child or you get a rash after using a repellent, go see your doctor and stop using that repellent, and maybe check out some different varieties to use. And if you do want to apply sunscreen, you apply that first and let it dry, and then put the repellent on. And so those are the tips that I have for you today for Zika prevention.
Hello, my name is Shelly Wood and I'm the nurse consultant for Zika at Kentucky Department for Public Health. There are many measures that we can take in order to prevent from becoming infected or spreading infection of Zika. I want to take the opportunity to inform travelers of precautions that they should know prior to travel to an area with active Zika transmission, otherwise known as a Zika-affected area. First of all, pregnant women should not travel to a Zika-affected area. Second, couples planning to start a family should wait to conceive for 8 weeks after travel to a Zika-affected area. All travelers should use mosquito repellent during travel and for 3 weeks after return from a Zika-affected area. Male travelers should wear condom with every sexual encounter for the recommended time frames depending on the situation. First situation. If a male traveler returns from a Zika-affected area and he does not have any signs or symptoms of Zika during travel or for 2 weeks after travel, then he should wear a condom with every sexual encounter for a period of 2 months. Second situation. If a male traveler returns from a Zika-affected area and he does develop signs or symptoms of Zika, then he should wear a condom with every sexual encounter for a period of 6 months. The third situation. If a male traveler returns from a Zika-affected area and his partner is pregnant, then he should wear a condom throughout the duration of the pregnancy, regardless if it is beyond the recommended time frame of the 2 months or the 6 months. Lastly, travelers who develop symptoms of Zika, which are fever, rash, joint pain, or conjunctivitis, during travel or within 2 weeks of travel to a Zika-affected area should inform their medical provider and discuss the need for testing. These measures, combined with other mosquito precautions, should protect you and your loved ones from becoming infected with Zika. Thank you.
Hello, my name is Cathy Fowler, Director of the Division of Public Health Protection and Safety. Mosquitoes breed in areas of standing water. The best way to get rid of or avoid a mosquito infestation in and around your home is to get rid of standing water by removing items that collect water and being vigilant. Disposing of unused containers, placing useful containers under a roof or protected with tight covers, and frequently changing the water of animal drinking pans and flower pots will greatly reduce the risk of infestations. Water storage containers should be kept clean and sealed so mosquitoes cannot use them as aquatic habitats. Container breeding mosquitoes are particularly susceptible to source reduction, as people can remove or cover standing water in cans, cups, and rain barrels around houses. Mosquitoes that breed in irrigation water can be controlled through careful water management. Once a week, empty and scrub, turn over, cover, or throw out any items that hold water like tires, buckets, planters, toys, pools, bird baths, flower pot saucers, or trash containers. Mosquitoes lay their eggs in or near water. Tightly cover water storage containers, buckets, cisterns, rain barrels so that mosquitoes cannot get inside to lay eggs. For containers without lids, use wire mesh with holes smaller than an adult mosquito. We would also like to address how to get rid of mosquitoes inside the home. Install or repair and use window and door screens. Do not leave doors propped open. Keep windows and doors shut and use air conditioning when possible. Keep mosquitoes from laying eggs inside your home. Once a week, empty and scrub, turn over, cover, or throw out any items that hold water like vases and flower pot saucers. Mosquitoes rest in dark, humid places. Mosquitoes often rest in the vegetation around the home during the heat of the day and under crawl spaces. In the home, they may also be found under the sink, in closets, or under furniture. Homeowners wishing to treat their home or yard should always read and follow manufacturers and labeling directions on pesticides.